because we've got this kind of middle-aged German Shepherd cross who has a history of acute onset of respiratory distress, and on thoracic radiographs it was found that it had bilateral pleural effusion, and so that was tested and it came back as chylous effusion, and so we're putting in bilateral chest tubes. So I'm just going to demonstrate how we're going to do that. Now this dog is struggling a little bit to oxygenate, and so getting this tube is going to be really important, get it into the chest cavity. So I've made my initial incision over about the 10th intercostal space, and then I've grabbed my Jackson Pratt with my right angle and I'm going to advance it 3 or 4 spaces, and then I'm just popping it into the chest cavity like that, and so that's popping in between the intercostal muscles. And then what I have to do is I have to advance this tube into the chest cavity. So I'm going to go ahead and remove the right angle. We've already got chylous fluid that's kind of coming out through our incision. So I'm just releasing that, and then I'm advancing the tube into the chest cavity. We may have lost that space. I'm going to have to re-grab it and pop it back through. We might be getting a little bit light. Alright, so I'm going to re-grab this, advance it, and pop it through that same hole. I'm getting chylous fluid out here already. This Jackson Pratt isn't particularly stiff. Sorry guys. Yeah. Push it in a little farther. Just that Jackson Pratt isn't very stiff is the issue. So I'm having trouble advancing it into the chest cavity. That's better, so pop that in there. Can I get a 60 ml syringe? So that chest tube is in the chest cavity now. I've got my 3-way stopcock attached here. And you'll see that we'll start evacuating just tons of this typical chylous fluid. I'm happy to, it's fine. Or do you want to suture it while I'm draining?
Just
yeah, so let's just get the dog stabilized first. So we're just going to have liters and liters of fluid in here.
There goes the suction bucket. Just a big bucket.
And just be careful we're not crimping that over. Based on what it looked like on the ultrasound, I wouldn't be surprised if we got about 3 liters of fluid off this dog's chest.
We got 4 liters yesterday.
4 liters yesterday. Right. So just draining fluid. I'm sorry I'm not looking at the screen, so I can't tell if there are any questions, so just put any questions that you might have in the comments later. Oxygen's coming out. Can I get some epivacaine, please? Just to inject along where the tube went into the chest cavity, because that'll make it more comfortable for him to breathe. And this typical kind of straw-colored pinkish tissue or fluid is what we typically get out of chylothorax. So the 4 mg per kg, yeah, full dose.
We'll go 2 on this side and 2 on the other.
Yeah. 2 mg per kg. Yeah.
2 mg.
mg on each side. I think 4 and 4. We do that every day.
How many mils will it be?
Yeah.
Is 2 linked to you? That's fine. Don't need it diluted.
I read something today that said that a good cardiac surgeon is someone that, when asked to name the 3 best cardiac surgeons in the world, they struggle to come up with the other 2. Good surgeon, good vet surgeon. Yeah. Is that all the fluid there that we've collected so far? Can I get some O nylon, please? What do you have there? 2O?
3O.
No, we'll go O nylon, please. Jack, can you come and hold that suction bucket in the camera field, just over next to Ewan? Just so this is what we've taken off so far. If you rotate that around, we can see. So that's 500, and it's not showing any sign of slowing down at this point. Now pulse ox is still 94. Yes.
This protein that's in the pile is not contributing to my blood pressure, so it's not good.
Thank you.
If we continuously, if the only treatment we do for this dog is to continuously drain its chest, it will become harder.
I might have you continue draining that. So now what I'm going to do here is I've got some zero nylon double arm, so I'm cutting one of the sutures off the needle, one of the suture ends. And then what I always do is, so I can palpate the tube underneath the subcute, I'm going to just pass a cruciate suture around the tube, and the idea here is to prevent air from leaking in around the tube back into the chest cavity. And this happens more commonly in cats because they have such floppy skin. So just a single cruciate suture like that, snugly. So again, we don't get any air leaking back in around the tube into the chest cavity. And then I'm going to put a little purse string suture around the opening of the chest tube. Being careful not to penetrate or perforate the tube with the needle. Even though it's only a tiny hole, you are going to get a lot of air leaking into the tube. And I'll leave some here. And then I'll just tie this first just to crimp or cinch the skin around the tube. And then I'm going to do a finger snare. I'm going to get Ewan to tug on that just a little bit, just to give me a little bit of tension on it. And then pass that underneath my arms to your other hand and back. Pull it tight. And then back through, pass it back. So when you have an assistant, putting in a finger snare is much, much faster. And so that's pretty much it. And we'll come around and make sure that we don't have any questions. Let's just show how much fluid we've already got. So we've got almost a liter there. I'll just come over and see if we've got any questions. So go ahead and leave it at that. So thanks a lot for watching. And if you have any questions, just post them on the comments below.